Hi everybody, Dr. Leona Allen here, and today I want to help you understand cholesterol and what those tests really mean. So many of you have gotten your cholesterol labs and determined whether it was high cholesterol or low cholesterol. So if it was high, you're typically prescribed a statin or a cholesterol lowering medication, or if it was low, you were sent home with a clean bill of health. Now, I'm not here to tell you to come off your medications. My intention here is to educate you. Now, let me explain to you why sometimes a person with high cholesterol can be at low risk for heart disease, and a person with low or normal cholesterol can actually be at risk. And that is because we need to understand the particles and not the total cholesterol. So let me just show you with an example. Cholesterol is carried in particles. So when you're tested and you're told that you have high cholesterol, that is because your particle has a high amount of cholesterol inside the particle. Here's another particle here. So if you have low cholesterol, you would have low cholesterol inside the particle. It is the particle that carries the cholesterol throughout the body. Let me use an analogy that'll make this clear to you. You have a car. We'll make the car the particle, and we'll make the people inside the car the cholesterol. So say you're in a traffic jam. What matters most in that traffic jam? Is it the number of cars or the number of people that are inside the cars? Well, if you said it's the number of cars, you are correct. In other words, the number of particles is what matters, not the number inside the particles. So, in other words, if you have low particles, that is better than if you had high particles. Now, what do these particles do? Now, in this example, here's the artery. And size does matter. So you have the large particles that are traveling in the artery. And here we have the arterial wall. So right here you can see the large particles, and the large particles do not lodge into the arterial wall, but the small particles do. So remember what I said, it's size that matters. It's the particle that matters. So it's the small particles that get lodged into the arterial wall. And this is oxidation and inflammation. So if you've seen some of my earlier videos, I discuss how inflammation is a link to a lot of chronic illnesses. And this shows how inflammation can cause heart disease. And that is these small particles that are lodging into the arterial wall. And then they eventually crack, forming an embolus. And then that embolus moves in the bloodstream. And if it travels to the heart, that is called what? A heart attack. And if it travels to the brain, it is called a stroke. So this is why inflammation is the cause of heart disease and not total cholesterol. This is what the NMR measures. It measures your particle size. Now, once again, I said you can have high cholesterol and normal particles, which put you at a lower risk for heart disease. And I've also seen people with low or normal cholesterol and have extremely high particles. This is the NMR. This is what the NMR determines, and it is a life-saving test.